Facial trauma, also called as maxillofacial trauma. It is basically any physical injury to the face. Generally, we receive such patients in casualty. We should first look for the general condition of the patient, his vitals, any active bleeding site, and we should manage accordingly. Generally, it is caused due to automobile accidents or due to sports injury or as a result of assault and fight. It may involve only the soft tissue or bone or both. A detailed history of the patient need to be taken before we reach the examination. To examine the face is divided into upper one third, middle one third, and lower one third by two imaginary lines. The upper one third includes the skin over the frontal bone and the scalp. We look for any lacerations or any numbness. The frontal bone is examined, eyebrows are seen, and the supraorbital ridge is examined. Till now, we include the upper one third of face. What all structures are to be examined with the middle one third of face? The middle one third of face, the examination includes the nasal bone along with the naso-orbital area, orbits both right and left, then the peri-orbital area, zygoma, malar bone, zygoma, malar bone, zygomatic arch, maxilla, and the upper teeth. Along with it, we include the examination of ear in the middle one third of face. The lower one third include externally the lips, the skin over it, the mandible, intraoral examination, and the temporomandibular joint. In some books, they have mentioned, in spite of the two imaginary lines, the one passing through the supraorbital ridge, the other passing through the upper and lower teeth junction. They have mentioned the division into four parts. In this, the upper one third and lower one third are the same, but the middle part of the face is further divided at the line of the pyriform aperture crossing the zygomatic arch, which divides the middle one third of face again into upper mid face and lower mid face. These imaginary lines are drawn and divided so as none of the structures are left for examination. No facial examination is complete without the examination of neck and the facial nerve. In this case, as it is a case of facial trauma, we should first look out for the general inspection, the elongation of face or a dish-like appearance of face or the intercanthal distance. Examining the firstly the upper one third of face. We will look for the skin over the frontal area, the scalp region, the lacerations over it, any numbness by comparing it on both sides. Looking for the eyebrow and the supraorbital ridge area, whether it is aligned or there is any step deformity. Coming to the middle one third of face, that includes the supraorbital ridge area till the upper lip and the upper teeth area. We will first look for the nasal bone. Is there any bony crepitus, edema, any surgical emphysema in the periorbital area? We will look for the eyelids for any lacerations, edema. Coming to the eye, we will look for the eye movements. We will look for the eye movements. We will look for the eye movements. We will ask the patient to follow our finger. We will see the movements both in the horizontal plane as well as in the vertical plane. फिंगर के साथ चलो उंगली के. We will observe and ask the patient for any diplopia, looking for the globe status, whether they are aligned in the same plane or the position or the level is disturbed. That is, one eye is in this level and other is in the lower down level. We should observe. In this case, both the level appears same. We will look for the globe for any proptosis, or in blowout fractures there may be sunken globe. We will then look for the vision, any orbital pain, tenderness, any subconjunctival hemorrhage. Now we will look for the infraorbital rim, whether it is intact or there is any step deformity. We will palpate it along the whole orbital rim on both sides. Then we will move to the nose. We will move to the anterior rhinoscopy. In this, we will look for the nasal septum, whether there is any septal hematoma, septal fractures, or there is any active bleeding from the nose. The bleeding may be only blood, or there may be any blood clots, or there may be rhinorrhea, which may indicate of CSF leak, as is seen in skull base fractures. We will look for any malar flattening. We will ask the patient to close his eyes and will look for any numbness, or there is any altered sensation on both sides will be compared. Then look for the zygomatic arch, any crepitations, lacerations over the cheek. Coming to the ear, we will look for the pinna, any bleeding, any laceration, any trauma, postauricular area and the mastoid area. Mastoid particularly, not in this case, there may be bruising seen called as the Biddle sign, seen in the cases of temporal bone fracture or the skull base fractures. Then we will do a otoscopic examination, where we will look for the status of the external auditory canal and the tympanic membrane. In some cases, you may get an active bleed or a blood clot. When there is an active bleed, take a cotton, put it here, then the soaked cotton is placed over a cotton bed sheet or any cotton cloth. On pressing it against it, we will see a clear halo sign. This means the clot is in the center, followed by a periphery transparent rim. That is due to the CSF leak. One should have a high suspicion of temporal bone or the skull base fractures in those cases. Then we will examine the maxilla, the skin over the area, the status of the upper lip, any edema or the decreased sensation. We will ask the patient to open the mouth and we will look for any loosening or the absent teeth, any active bleeding or bruising. We will look for the floating maxilla or when there is a fracture in the maxilla. How we examine? With our index finger and the thumb. We will put our index finger over the palate and thumb over the upper teeth and will gently put a pressure over it. In cases when there is a maxilla or the palatal fractures, this whole fragment moves upward and downward. This is not seen. Lower 1/3 of face examination. In this, we will look for the lower lip, anesthesia or any decreased or altered sensation over the lip, any lacerations or any bruising. We will ask the patient to open the mouth and we will look for the GB sulcus, buccal mucosa, is there any bruising. We'll look for the dental status, any dentoalveolar fracture is there, loosening and the missing teeth are count. We'll look for the alignment of the mandible, both internally and externally. In this case, you can very well appreciate there is a malalignment of the mandible. See, this is one level and there is one fractured fragment, and this is the mobile fragment of the mandible. So the fracture line is there. We will look for the status of the tongue. Is there any active bleeding? Here there is a suture over the tongue. We will look for the palate, anterior tonsillar pillar, posterior tonsillar pillar, tonsils, and the posterior pharyngeal wall. One should also examine the gag reflex and the bilateral palatal movements. Externally also we will examine, is there any break in the continuity of the lower border of the mandible. Here there is one mobile fragment on palpation found. Sutured wound over the mandible is there. Ask for the tenderness or the pain over the temporomandibular joint. One more point in intraoral examination is, one should ask the patient to clench his teeth. In this, we will see the occlusion. In occlusion, what we see, the last molar teeth of both upper and lower part are well aligned or not. In this case, there is anterior bite deformity. This means the occlusion is deranged. On this side, there is early mature contraction, and on this side there is gaping. In this case, we say that the patient is having anterior bite deformity on the right side and a premature contact on the left side, as the mandible alignment is deranged due to fracture at the parasymphysial region. No facial trauma examination as far as ENT is concerned is complete without the facial nerve examination and examination of neck.